We've all called a physician's office. We've probably all called our health insurance or tried to do something on their website, right? That experience, especially when I started, it's getting better, but it's pretty universally bad. And we all have high expectations because we're kind of spoiled by Amazon and Uber and some of these other applications that have really allowed us to have a much easier experience doing things that we tend to do every day, calling a cab, buying anything really on Amazon. And so those are the experiences that we'd like to see across other sectors. And that was kind of how I came into this was when someone approached me about contact center, I kind of was cocked my head and went, I'm not sure why I would be interested in working around contact center. But I will tell you that I started to really think about the patient experience and I started to say, you know what? There's nowhere to go but up. So, how do we go and impact that in a meaningful way? I always come with the personal perspective of I'll call my primary care physician, which I've been with for 20 years now. And every time I call, it's like the first time I've called, right? I'm brand new every time because they don't know who I am. They don't know my journey. And I have to say all the things all over again every time. That was the first thing I wanted to solve was how do we connect the system of record to the agents that are answering the phone so that they're not having to go and look up things and doing all sorts of things and asking you all those questions that are quite frankly annoying. How do we take those bits of information and turn them into an experience that feels like, okay, we know you. Now let's route you. We know what you're calling about. We know the problem that we're trying to solve. Who do we get them to that can answer their question the first time?